Hello, I'm the ordinary doctor, Dr. Manan Mehta, with the extraordinary Dr. Himanshu sir with us today. Himanshu sir is a practitioner who has the highest number of cases in Mumbai right now. No matter what field you see, sir is at the forefront of seeing most of them and then filtering a few of them across. So we'll just get right into it and we'll say hello to Dr. Himanshu sir. Please, sir, welcome to our very simple platform, The Ordinary Doctor. Sir, if you could just introduce yourself in a couple of lines for us, please.
First of all, thank you, Dr. Manan. And you are not ordinary. In fact, we are very much ordinary in the like against the knowledge which you possess and the hard work and the efforts you take to share the knowledge across the GPs and towards the patients and educate the families. So thank you very much once again to take me on the board and to discuss something which is like fever things which is going on right now in the city of Mumbai and all across the India. So I am into the general practice since around 20 years plus now and working in the 3 charitable clinics. As you rightly said, there are a lot of patients with the fever. So if I'm seeing around 100, I see around 70 to 75% patients coming with the complaint of fever. Now, very important at the GP level to differentiate and find out the type of fever. Now, when I have to see more number of patients in a limited period of time, so that becomes very important for us to come to the conclusion and you can say it as a differential diagnosis, and we have to just prescribe, explain, and let the next patient come. So if you say that today's time right now, a lot of malaria cases and a lot of simple flu, you can say. We are not seeing much of dengue, but yeah, there are a few scattered cases of dengue, but not that much. And of lately, we are seeing in last 2 weeks again little rise in the COVID and H1N1, more of viral, like because H1N1, COVID, and a simple flu and a malaria. So this is like a mixture. Now, as we all know the symptomatology about the cases, like malaria, the patient comes that, sir, कल तक कुछ नहीं था, रात को जोर से बुखार आया, एक दो कंबल लेना पड़ा, बहुत पसीना हुआ, बुखार निकल गया, थोड़ा अभी बदन दर्द कर रहा है, सर दर्द है, खाने की इच्छा नहीं है. These are the basic things. So very classical symptoms: malaria, fever with chills, headache, body ache.
And the
These are
chills is
classical
capri.
symptoms.
They literally shiver. They've got that
Yes,
nice
yes,
dramatic tremor.
yeah, yeah. There are a few cases where may not have that chills, but yes, of course, there is a symptoms of malaria. They are most of the time associated with little gastric discomfort because of course, hepatosplenomegaly thing, loss of appetite. Sometimes they do have a diarrhea complaints. It's not that the diarrhea, what we get it into the viral gastroenteritis or something. They may have just 1 or 2 episodes of watery stool, not that frequency and multiple times, and not the large quantity. Whereas when you have to differentiate between the flu, very simple thing is that they have more complaint of little low grade fever rising gradually going up to 103 4. Then a lot of body aches, especially they complained of the polyarthralgia, spine pain, and the calf muscle. This is classical going into the viral. On day 1 they come up with little rhinorrhea. Day 2 3 they come up with nasal blockage, throat irritation, tickling cough, and there is more of a dry cough. And later on, if it settles down, yes, then you get sometimes wheeze, sometimes little crepitations and all that.
And this
But
is the
otherwise,
stage where, without asking you, patient has already purchased azithromycin from the pharmacy and they have started taking azithromycin.
every patient,
Every patient comes with azithromycin
not
inbuilt.
pharmacy, not pharmacy. Now what I feel is like every house has got, after the COVID, every house has got paracetamol 650 by default, azithromycin, vitamin C, zinc.
Which is the main reason why we wanted to talk today, is that sir very rightly said that malaria and dengue is also around, and it's not just the flus. Sir very clearly mentioned to us virals. bacterial secondary infection पीछे से होता है, then maybe antibiotic is of use, but mostly these are virals. Antibacterials don't work on them. And please remember, sir said malaria, dengue is also going on. I agree completely. I've had quite a few patients admitted under me for malaria, dengue also. Remember, in malaria and dengue, platelets drop. So if you have fever, be very careful. Don't just pop any of the combination drugs which contain ibuprofen or diclofenac or any other fancy drugs. Plain, as sir
No
said,
use.
paracetamol 650 is what you do. Otherwise, the
Yes,
platelet will drop. So till you get the diagnosis.
they will consume one tablet or bukhar nahi chuta hai, so you can go up to repetition of the paracetamol max 4 times a day, I would suggest. But to lower the temperature, सबसे पहला क्वेश्चन सर यही आता है, सर बुखार नहीं उतरा, आई हैव टू एक्सप्लेन देम दिस इज द डिजीज, इट हैज इट्स कोर्स, have patience, give a 2 3 days time, whether it is malaria, whether it is viral, whether it is dengue, all has its course. You have to respect the disease. We should learn to respect the disease and not keep on popping up with the tablet. That is very very important. Body garam ho raha hai, cells are heated, you just take rest and hydrate yourself enough. Once you start telling them hydrate, so next question comes, sir kya peene ka? So simple answer is, you can have everything whatever you want except alcohol. Manan sir, I have seen a lot of patients, with the rhinitis, they start again. Cetirizine has become one common tablet available in everybody's house. Okay, so they will take one or two cetirizine. They suppress that secretion, leading to the chronic sinusitis.
Correct.
I would suggest that one day let that discharge come out. This is my personal opinion. At least for day one, let it come out. Don't push it back inside to the sinuses. Don't give a cetirizine on day one. If you want to give something, vitamin C is the best thing to be given. Vitamin C is the best thing to be given. And, and gargle and steam is definitely going to help them to protect the lower respiratory area.
So one more thing which was very nicely taught to us by Dr. Vinod Mehta, what he said was that, see, not everybody can do Jal Neti, which is the treatment of choice, where you flush the sinuses rather than block them up. So if you can't do that, then nasal saline drops are also fine. So from pediatric to geriatric, anybody can just do nasal saline drop. There is no harm in that at all. So I think to summarize what sir is saying, if you have fever, you will have fever. Death, taxes, and fever. If you want to live in Mumbai, that is compulsory. These three things are compulsory for you. So if you have fever, please don't rush to take an antibiotic. So primarily, whether doxycycline, which is an atypical antibiotic, or one of the cephalosporin derivatives, or a fluoroquinolone, or a macrolide, let your physician take a call on that. And most of the physicians will immediately tell you that get a routine test done, or if your symptoms are mild, wait for 36 hours and then we will see what is to be added. In the initial part, as sir has told us, hydration is most important. Paracetamol, you can take up to 4 tablets a day. See, the dose prescribed is 15 milligram per kg per dose. So that is the reason why many people don't get an immediate result also, because if you're 75 kg, okay, your dose required is 15 milligram per kg per dose, so 500 milligram crocin might not work. On the flip side, if you're a 40 kg lean, very young, small lady, you're taking 650 milligram at the same time, you'll get too much sweating and fever will rise back as soon as the paracetamol washes out. Steam, gargles, nasal saline drops, and vitamins, as sir has said, these are the things which you initially do. For the rest of the thing, this is not a routine period which we face. In Mumbai, usually lot of illness is there. 7 दिन बारिश, 7 दिन धूप equal to 15 दिन बीमारी. So we have to be little careful. Don't be experimental with your medication. Have a word with your physician. They are seeing hundreds of patients a day. They'll be able to guide you a lot better. Sir, last question before we close the talk. Do you recommend vaccinations like flu shot, etc., to be taken right now, or should we wait for this period to get over?
Personally, I would say not to vaccinate right now.
Okay.
Wait for some time, because I don't know, everybody may be having some sort of symptoms, and at that point of time, whether it is going to be effective or not.
Thank you. to the extraordinary
Thank
Dr.
you, Dr.
Himanshu
Manan.
sir
Have a great
for
day.
being with us,
Thank you.
and we'll call him back on the metabolic soon. Thank you, sir. Thank you.
Thank you, Dr. Manan.